down the road. So everybody's going to be on the same page, and we're all going to know what everybody has to do to get this done. The first thing I want to say is you will notice that I'm kind of giving you information in the aggregate, even though Jesse and I and Clint have specific information, very detailed for each account, and we also have a schedule. I think everybody knows what a big issue this is in Bayview, and until we are in the position to notify each account holder, we are being very careful about the specific account holder information being held confidential, because everybody that we have talked to, it's like, well, as soon as they pay what they owe, I'll pay what I owe. So until everybody gets their information, we're going to kind of protect that and make sure that everybody is notified at the same time. So, given that, I'd just like to start through this outline. And Jesse, you holler, because a lot of this deals with you and Clint. Clint, you do the same thing. We talked about, we have the detailed per account recap sheets. We develop them so that they have, this is what you're paying now, this is what our adjustment shows that you owe us, this is your new amount, this is the increase or decrease. I think there's one account that had a decrease of like $4, but most of them are significant increases. The big item that we have yet to determine, and we have to have it before we contact the people, we have what we are charging for them right now for the number of ERs, but we do not have the total ERs that are assigned to each account. Some of them we have, some of them we do not have. This is a vital piece of information that we're going to need, because we have to reconcile what their ER status is to what we show.
What do you mean we don't have, can you say that statement again? We need to...
Okay. In your schedule, I know that we have what's occupied, okay, what we're charging them for. But when you and I talked the other day, we need to have the occupied, vacant, and reserve total ERs that we have assigned per account. That's the only way we can determine if we have adequate ERs assigned to each account.
Okay.
You know, just like with Creekside, Jesse. You know, we knew we had 8, but a lot of these, and you know which ones, we don't know. So
yeah, well, and just to clarify, we somewhat know. We just need to detail them to the specific accounts, but we do have the information available to us.
Okay, and is it readily available? I just need to know how much effort is it going to be in a timeline, because I know right now this probably isn't the opportune time for you guys because there's a lot of other stuff going on. So I need to know what that means.
Yeah, well, I think because after I did the ER spreadsheet, I was under the understanding that I would then be part of some workshops. So I feel a little detached from the project, so it's hard to tell where to jump in and when to be needed. But I know that the ultimate goal that is that we have the ER spreadsheet in Excel format, and we can go through and update that.
And is that the one that Jan did?
Yes, and we can update that and include a column with account numbers and then the occupied versus reserved. So we have
Wonderful. So it is, because I was going to
the
ask,
template ready to go.
I was going to ask Sean if he might pitch in and help with that, because I know you have talent in that regard, and it sounds like from what Jesse has, it wouldn't be a lot of effort. They could show you and then schedule that information for us.
Yes, show me what's needed.
There you go, Jesse.
Show me what's needed and I can compile.
Okay, well, it would require being on the office computer and in our billing software, which is something that Clint and I can do. I'm worried that Colleen's lack of feeling or getting some help might be a disconnect between understanding exactly where this project status is at. I was under the understanding that there would be workshops created. This would be a group effort. And I'm worried that Colleen's taking on all health and in an attempt to get things done, which the district definitely needs to do. I was hoping that it could be done in an organized workshop fashion.
Well, that's what we're doing today, and
so that everyone knew what was going on.
I did attempt to we had a meeting set up, unfortunately, when you were very ill, and that was kind of what we were going to do, was have a workshop with you and I and Cooch and Clint to try and get some of this stuff organized before we had today, and of course, we couldn't work that out. Basically, what we're trying to do here, Jesse, is we've determined that this has a priority. There's $25,000 worth of money involved here. So we're trying to decide what resource do we need to get this done in the fastest time frame we can. So that's why I'm getting down to this detail.
Yes, I agree. I definitely see the urgency and the priority, and I don't want to step on toes, but I am worried about, and I know that there was the workshop that was created. That's been one workshop so far, after a lot of work has already been done. And it makes me feel very detached from it. It's hard to jump into it. So I'm not looking to step on toes, but I am a little worried about the amount of effort that is going into it with one person's eyes so far, and it's a little hard to jump into something and know exactly how I can help if it hasn't been a group effort. It's very confused, and I was just, I know the urgency on it. Am I breaking up?
A little bit.
Okay, is the majority of what I'm saying?
I haven't heard you break up much, no.
Well, then I have attempted to keep you updated, but this isn't what we're doing here today. We're trying to make decisions about how we can move forward. I've provided you with very, very detailed information as I've progressed here. So we are at number 2, which is a primary and critical thing that needs to be addressed. So what will give you a comfort level, Jesse, for us to get this information?
Yes, and that's what I'm trying to answer. Excuse me if I'm going about it in a lengthier version. But I guess what I'm ultimately trying to say is it's hard to tell where I can jump in and give you definitive answers. I just think it would be beneficial for multiple eyes on it, and it would be a great time management thing. Multiple people sharing the load can expedite the process as well. And then also, I just don't want you to overwork yourself to death, Colleen. I know that you are.
All right, that's not your concern, that's my concern. So I just got you extra help, you want more bodies, so I just got you another body. So we have another set of eyes on this. So can you tell me how you can move forward?
Well, having another body in the office utilizing the district computer would either cut into Clint or I's time. So carving out time for Clint and I to be able to get on and do it would ultimately would be best, since we are utilizing the computer. But
Talked about 2 days ago, you informed me that was impossible for you to do. So,
no, I didn't say that it was impossible for me to do.
well, in a timely manner, you did. So I guess I am totally lost about how we can proceed to get this done.
I just stated that those days I was doing fiscal year-end activities, which do utilize the computer. So even if somebody comes into the office to try to help, which I appreciate, ultimately it's just tasks that the district has at certain times that need that computer. So even with somebody else coming in to help, it would utilize that computer and still put off those tasks that still need to be done for the district. There's just...
Okay, so I'm looking for you, I'm getting all kinds of reasons it can't be done. Can you give me any indication of how we can proceed to get it done and what that time frame would be?
I'm sorry that you're taking it as always that it can't be done. That's not what I'm saying. I'm just saying that there's so many resources that the district has with the computer use, and there are things that need to get done. But we can definitely schedule weekly workshops. I think that would be a great idea. Then we know when to sit down and when to tackle these things, what the next steps are, and a great game plan. So if you want to schedule workshops, I would love to do that.
This is a workshop.
We are in a workshop.
You're in a workshop.
Yes, I know. And they're helpful.
That we need to decide in this workshop right now is how can number 2 get done, Jesse?
By scheduling another workshop, that's what I'm saying. So let me know what time to come into the...
5 people to get somebody to update the ERs.
No, I'm saying with you, Colleen, because I know that you've been doing a lot of this stuff and I want to help you. I'm saying that you can come into the office, you can, because there's a lot of the emails, yes, but I really like the idea of hands-on working together ideas. So I can start working on the LID Excel spreadsheet and getting the account numbers into there and getting the columns going on the occupied, reserved, and I can do that step as my next one. And I can do that, I'll say, let me look at the calendar, because this is a great time. I can start doing some of that Friday. And then if you would like, on Tuesdays, you and I can set up a consistent time that we can touch base on this so that I feel like I'm remaining with a good pulse on it. Because lots of emails of updates on your information can get confusing for me at times. So I like the idea of a hands-on workshop where we can work together. And if you're available Tuesdays for times, I'm open to that idea. If you like another day, I can do that as well.
Can you give me the date of the next Tuesday?
That would be December the 7th.
Okay, I think that's all right.
Okay.
This is proprietary information that we're speaking of. I mean, our list, our Excel document, what information, we don't want that going out to the public.
Correct.
The details of it.
Right.
Is it a document that can only be worked on the district computer?
To utilize the billing software to understand what we have, yes.
Right in. So the Excel document has formulas in it and such like that, the tags that go to other documents?
No, because we can't tag it to our billing software. The billing software is not set up that way.
Someday.
Yeah. Maybe. I don't know. I guess we could ask El Dorado if they have any way to do that.
I guess where I'm going is that I'm trying to ask more questions to wiggle in. So this is the document that was created by Jan, and what